If you want to get all the information you need to know about Medicare for you or your spouse's upcoming enrollment, you came to the right place. Let's discuss all the details about Medicare and how it works right now. Hey, Andrew Walsh here. I'm an independent Medicare broker helping people across the country with their Medicare choices. If you are new here, make sure to hit that subscribe button. And if you ever need any help with Medicare, feel free to reach out to me. My contact information is in the video description below. Also, if you're watching this video in 2022 or beyond, I will have updated Medicare information in the video description as well. Okay, most people become Medicare eligible at 65. You can apply early for Medicare if you have end-stage renal disease or if you are disabled. Now, Medicare always starts on the first day of the month. So, for example, if you turn 65 June 15th, then your Medicare start date would be on June 1st. If your birthday lands on the first day of the month, then your start date will be moved 1 month ahead. For example, if you turn 65 on June 1st, then your Medicare start date would be on May 1st. You'll be automatically enrolled into Medicare at 65 if you're collecting Social Security or Railroad retirement benefits. But if you are still waiting to collect on Social Security benefits, you will need to manually enroll into Medicare. You can usually manually enroll into Medicare up to 3 months before you turn 65, and you'll need to contact Social Security to enroll. You can set up Medicare by going to your local Social Security office, calling Social Security, or enrolling online. Now, who should enroll into Medicare at 65 that is not already collecting on Social Security? Well, you should enroll if you are currently uninsured, enrolled in the ACA or Marketplace health insurance plan, enrolled in a faith-based health sharing plan or other non-ACA compliant health insurance plan, if you're a retired service member on TRICARE, if you're on COBRA insurance, and if you or your spouse are currently working and have a group health plan with an employer that has less than 20 employees. You should also usually enroll into Medicare if you're currently receiving retirement health insurance coverage, but make sure to check with your past employer's benefit department to make sure you should enroll into Medicare at 65. You can also enroll into Medicare if you or your spouse are currently working and your group health plan has over 20 employees. But only do this if the cost and benefits of Medicare are better than your current group health insurance coverage. You should not enroll into Medicare if you're an active duty service member, but make sure to enroll just before you retire so you don't have any break in coverage. You should also not enroll if you or your spouse are working and have a group health plan with over 20 employees and your current coverage is better than Medicare. You'll need to do a cost-benefit analysis between your current coverage and Medicare to see which plan is better for you. If you do decide to stay on you or your spouse's group health plan, you do have the option to just start Medicare Part A and wait to enroll into Medicare Part B until later. Medicare Part A is usually free, and you may get some added benefits if you enroll into just Medicare Part A. You should not enroll into Medicare Part A if you want to continue to contribute to a health savings account or HSA. So just to be safe, if you plan on staying on your group health plan or health insurance at work, make sure to check with you or your spouse's benefit department to make sure what parts of Medicare you should enroll into. If you do decide to delay enrolling into Medicare, you can enroll into Medicare at a future date when you do retire or if your group coverage ends for any reason. Quick review. Most people become eligible for Medicare at 65, and Medicare always starts on the first day of the month. If you're collecting Social Security or Railroad retirement benefits, you'll be automatically enrolled into Medicare. If you are delaying Social Security, then you'll need to manually enroll into Medicare, and you can do this up to 3 months before you turn 65. You should usually enroll into Medicare at 65 unless you're a current service member or if you or your spouse are still working and have a group health plan at work with an employer that has more than 20 employees, and that current group coverage is better than Medicare. It's also important to enroll into Medicare before the month you intend to begin receiving Medicare coverage, because you may be penalized or your Medicare start date can be pushed back if you wait. So just make sure to contact Social Security 60 to 90 days before you intend to start receiving Medicare benefits. Now, Original Medicare is broken up into two parts, Medicare Part A and Medicare Part B. Medicare Part A pays for your inpatient care at the hospital. So basically, Part A pays for your room and board at the hospital, and it covers medical services that require admission into the hospital. Medicare Part A also covers things like skilled nursing facilities, nursing homes, and hospice care. Lastly, Medicare Part A can pay for home health services if a doctor certifies that you are homebound. Most people get Medicare Part A free because they or their spouse paid Medicare taxes while working. Medicare taxes are part of your payroll taxes, and you need to have paid Medicare taxes for 10 years or 40 quarters to qualify for free Medicare Part A. If you or your spouse did not work or pay payroll taxes for 10 years or 40 quarters, you will need to pay for Medicare Part A. Medicare Part A will cost you $471 a month if you or your spouse paid payroll taxes for 0 to 30 quarters, and $259 a month if you paid between 30 and 39 quarters. Next, Medicare Part B pays for all your outpatient care. This means that Medicare Part B pays for your doctors, services, supplies, and equipment that are needed to diagnose and treat a medical condition. This would include things like CT scans, lab tests, and surgeries. Medicare Part B also covers Medicare-approved preventive services, durable medical equipment, mental health care, and ambulance services. Lastly, Medicare Part B usually covers drugs or medications you would not usually give yourself, like shots and injections you get at a doctor's office or in a hospital setting. Medicare Part B is not free, and most people will pay $148.50 a month for it. You may need to pay more for Medicare Part B if you make more than $88,000 filing taxes individually, or $176,000 filing taxes as a family. Make sure to pause the video right here if you make more than $88,000 filing taxes individually, or $176,000 filing taxes jointly to see how much you will need to pay for Part B of Medicare per month. They look at your income from 2 years ago when calculating your increased Medicare Part B premium. And if your income decreased to a lower bracket while you're on Medicare, you can fill out a form with Social Security to lower your monthly Medicare Part B premiums. Now, Medicare is very good coverage, and you can go to any hospital or doctor in the U.S. that takes Medicare patients. You don't need any referrals or prior authorizations because you and your doctors are in charge of your care. Medicare Part A and Medicare Part B are not perfect though. Both of these parts of Medicare do have some deductibles, co-pays, and co-insurance you need to know about. A deductible is what you pay first before Medicare starts paying anything. A copay is a dollar amount you pay per service, and a coinsurance is a percentage you pay in tandem with Medicare after you meet the deductible. Now, most people have a separate plan on top of Medicare to pay for most of these, and we'll get into those later. But if you do decide to go on just Original Medicare Part A and Part B, then this is what you get. So Medicare Part A, or the part that pays for your inpatient care at the hospital, has deductibles for days 1 through 60, 61 through 90, and 91 through 150. And as you can see here, they are $1,484, $371, and $742. It's important to point out that the $1,484 deductible is per 60-day benefit period. So you can end up paying for it more than one time a year if you're admitted into the hospital more than 60 days apart. And days 61 through 150 in the hospital are also per day. So inpatient hospital costs on Medicare can really add up fast and be extremely expensive for long inpatient stays. Also, anytime you spend more than 90 consecutive days in the hospital, you begin to use up your 60 lifetime reserve days. So this means you only have 60 days to use in your lifetime for the 91 through 100 consecutive day window. Medicare does cover your first 20 days in skilled nursing facility care if you go into a facility within 30 days of admission into the hospital. But you must pay $185.50 a day for days 21 through 100. You also need to be admitted in the hospital for at least 3 days prior to entering a skilled nursing facility. Lastly, Medicare Part A will not cover you past 151 days in the hospital or 100 days in a nursing facility. Okay, next up is Medicare Part B, or the part that pays for your outpatient care. Now, you'll need to pay a $203 deductible before Medicare's 80/20 coinsurance kicks in. Let's go straight to an example. Let's say you have a doctor bill for $10,000, so you'll have to pay the first $203 or the Part B deductible. Then the $9,797 gets split up with Medicare paying 80% and you paying 20%. So you pay $1,959 plus the $203 deductible, and Medicare would pay $7,836. It is important to understand that the 20% coinsurance you pay after the $203 deductible is not capped. This means you have unlimited risk with Medicare Part B. Medicare Part B also does not pay for your Part B excess charges. Part B excess charges are where some doctors can charge 15% more than what Medicare is willing to pay for a test, surgery, or procedure. So basically, that 20% copay can be as high as 30% with some doctors. Excess charges are rare, and they can easily be avoided by only working with doctors who take what's called Medicare assignment or agree to the payment terms of Medicare. Lastly, Medicare does not pay for your first 3 pints of blood, anything outside the United States, long-term care, most dental and eye care, cosmetic surgery, hearing aids, and routine foot care. Medicare does pay 100% for some screenings, vaccines, and counseling, but you should always check with your doctor or service provider to make sure it's considered a Medicare preventive service. And your annual physical will now be considered an annual wellness visit. The annual wellness visit will not be as thorough as a physical, and you may need to pay out of pocket for what you consider a physical under Medicare Part B. Another quick review. Medicare is broken up into 2 parts. Medicare Part A is for your inpatient care at the hospital, and Medicare Part B is for your outpatient care, and it covers your doctors and their services. You usually get Medicare Part A for free, and you'll need to pay $148.50 or more a month for Medicare Part B, depending on your income. Medicare is very good coverage, but it has a bunch of different deductibles, co-pays, and co-insurances, and you can get a separate plan on top of Medicare to pay for them. Medicare does not cover everything, and you'll always need to check with your provider or doctor to make sure the services you want or that are recommended to you are covered by Medicare. Now, you have quite a few options after you enroll into Medicare. You can just stay with original Medicare and have nothing else. You can stay on original Medicare and add a Medicare supplement plan to pay for Medicare's different deductibles, co-pays, and co-insurances. Or you can leave Medicare and join a Medicare Advantage or Medicare Part C plan. Medicare Advantage plans are private insurance plans that must at least cover what Medicare covers, but they have their own rules, deductibles, co-pays, and co-insurances. Some people also may have a retirement health plan that acts as a supplement, and it will pay Medicare's different deductibles, co-pays, and co-insurance. And others will be low income, already on Medicaid, and will have to pay very little or nothing out of pocket for Medicare when they join. So if you want better coverage than just original Medicare, and you don't have a retirement health plan, or you're not on Medicaid, or you can't qualify for low-income programs, Then you'll need to decide between a Medicare Supplement and Medicare Advantage plan. You cannot have both of them at the same time. So you can either have Part A and Part B of Medicare along with a Medicare Supplement, or you can just have a Medicare Advantage plan. This is because Medicare Supplement plans work alongside Medicare Part A and B as opposed to replacing them like Medicare Advantage does. You will still need to pay for Part B of Medicare for both, and I'm just going to go over some of the advantages and disadvantages for each. Medicare Advantage plans are lower cost, with their most popular plans having $0 premiums. Most include drug coverage and also have some benefits for hearing, dental, vision, and wellness. The negatives of Medicare Advantage plans are they have networks of hospitals and doctors where you have to go to their hospitals and go to their doctors. Medicare Advantage plans have lots of different deductibles, co-pays, and co-insurances, just like Medicare. And you pay these until you reach the max out of pocket on the plan. And Medicare Advantage plans can have max out of pockets of up to $7,550. Medicare Advantage plans are also not standardized and change yearly. Lastly, Medicare Advantage plans are more expensive in the long term for chronic conditions. Medicare Supplement plans, on the other hand, have predictable costs. They are standardized by the government, so they don't change year to year. Medicare Supplements do not have networks of hospitals and doctors, just like original Medicare, and you can go to any doctor or hospital that accepts Medicare patients. Different Medicare Supplement plans cover some to all the deductibles, coinsurance, and copays of Medicare. Lastly, Medicare Supplement plans are guaranteed renewable, so the plan stays the same for life. The only real negatives about Medicare Supplement plans are they are not free and you do have to pay a premium for them, and this premium does increase over time. Lastly, with Medicare Supplements, you need to purchase a separate prescription drug coverage. I cannot go into detail and give you examples of Medicare Advantage plans because they are heavily regulated. So if you want to learn more about them, make sure to work with a local agent that represents multiple carriers. But I can get into all the details of Medicare Supplement plans because they are standardized by the government, and all Medicare Supplement plans must offer the same basic benefits. Here are all 12 standardized plans. But Medicare Supplement plans F, G, N, and High Deductible F or High Deductible Plan G are the only plans that are competitive around the U.S. It's important to point out that Plan F and Plan High Deductible F are being phased out of the Medicare Supplement program, and they're only available to people who are eligible for Medicare before January 1st of 2020. Here's a brief overview of all 5 plans. Plan F is the easiest to understand, and it covers 100% of the gaps in Medicare. So if you enroll into Plan F and have a Medicare-approved claim, it will cover all the deductibles, co-pays, and co-insurance of original Medicare. Plan G is also very easy to understand, with it covering 100% of the gaps in Medicare with one exception. And that exception is that Plan G does not cover your Part B deductible. The Part B deductible in 2021 is $203. So with a Plan G, you pay $203 out of pocket, and then all your Medicare-related services after that are covered 100%. Then there's Plan N. Plan N also does not cover your $203 Part B deductible, much like Plan G, but you also pay a $20 copay for doctor visits and a $50 copay for emergency room visits that do not result in inpatient admission. With Plan N, you also must pay Part B excess charges. Part B excess charges are when some doctors or specialists can charge up to 15% more than what Medicare is willing to pay for a test, surgery, or procedure. These excess charges are rare, but you do need to take them into consideration when making a decision. Lastly, there's High Deductible Plan F and High Deductible Plan G. These two plans act just like their Medicare Supplement Plan F and Plan G counterparts, but you must pay a $2,370 deductible before the plan benefits kick in. Monthly premiums for plans F, G, N, and high deductible plan F and high deductible plan G are different from state to state and even within different zip codes within each state. I ran quotes across multiple states for people turning 65 and found out the average plan F was about $130. The average plan G was $104. The average plan N came in third at $85. And the cheapest plans are high deductible plan F and high deductible plan G at about $40 a month. These prices make sense with plan F having the most benefits and being the most expensive, and the others having less benefits and being cheaper. Now, because Medicare supplements are standardized by the government, you can get them from any agent around the country, and you're usually better off looking outside your local area to get the best deals on your Medicare supplement plans. A local agent is useful for Medicare Advantage plans because of the restrictions and networks involved with Medicare Advantage. But they usually come up short with Medicare supplement plans because they do not represent some of the big national carriers. And it's important to understand that different Medicare supplement companies charge different premiums for the exact same plan benefits. Time for another review. If you want better coverage than just original Medicare Parts A and B, and you don't have retirement health coverage, or you're not on Medicaid or any other low-income programs, then you need to decide between a Medicare supplement plan and a Medicare Advantage plan. Medicare Advantage and Medicare supplement plans are very different. Medicare Advantage plans replace original Medicare Parts A and B with a private health insurance plan that must cover at least what Medicare covers. Medicare Advantage plans are less expensive and offer some additional benefits that Medicare does not. But they do have network restrictions and various different deductibles, co-pays, and co-insurances that you'll need to pay until you reach the max out-of-pocket on the plan. Medicare supplements, on the other hand, are more expensive, but you'll still be on original Medicare and you can go to any hospital or doctor in the country that accepts Medicare patients. Medicare supplements are standardized by letter and cover some to all the deductibles, coinsurance, and copays of Medicare. Lastly, if you plan to go with a Medicare Advantage plan, look for a local agent because they know the plan networks. And if you decide to go with a Medicare supplement plan, you can look outside your local area to look for the best deal. Okay, the last piece of the puzzle we'll need to cover is Medicare Part D or your drug coverage. Most Medicare Advantage plans have Medicare Part D rolled into them, but you will need to pick out a Medicare Part D plan if you decide to go with a Medicare supplement and sometimes some special Medicare Advantage plans. Medicare Part D plans are run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Now, every plan has a list of covered drugs or a formulary, so they put drugs into different tiers and have different costs for each tier. Part D companies can change their formularies each and every year, so it's always important to always check and make sure you're on the lowest cost plan for the drugs you are currently taking. The best time to do this is during your annual election period. The annual election period runs between October 15th and December 7th of each year. Changing your prescription drug plan during this time will make your new drug plan effective January 1st of the upcoming year. Now let's talk about the most popular pastry in Medicare, the donut. A donut is used to represent how most drug plans work on Part D of Medicare. So before you get any coinsurance from your drug company, you need to pay a $435 deductible. After that, you must pay a copayment. I will use 20% in this example. So you pay 20% and then the drug company pays 80% until you and the drug company have both paid a total of $4,020. This is when you reach the donut hole or the coverage gap. In this gap, you'll be responsible for paying up to 25% of brand name drugs and 37% of generic drugs. Now, when you and the insurance company have paid a total of $6,350, you then move on to catastrophic coverage. This is where the government steps in and helps out the insurance company. You then are responsible for 5% of drug costs from this point until the end of the year. Now, don't let the $435 deductible scare you if you're on some generic and moderately expensive medications. A lot of these plans do pay a portion of the cost of generic and other medications during the deductible phase, and you'll most likely not have to pay the full retail cost for your prescriptions right away. Again, you may have to pay more for Medicare Part D if your income is above $88,000 filing taxes individually, or $176,000 filing taxes as a family. They look at your income from 2 years ago to calculate your increased premium. And here's a chart that goes over the additional amount you'll need to pay on top of your Medicare Part D plan premium if you make more than $88,000 filing taxes individually, or $176,000 filing taxes jointly. Again, if your income decreases to a lower bracket while you're on Medicare, you can fill out a form with Social Security to lower your Medicare Part D premiums. Now, here's a simple game plan for anyone who is planning on starting Medicare soon. First, you'll need to get original Medicare Part A and Part B set up. Some of you will be automatically enrolled into Medicare because you're collecting Social Security, and you'll receive your Medicare card about 3 months before you turn 65. These people don't need to do anything but wait for their cards to come in the mail. Others will need to manually enroll into Medicare because they are turning 65 and still waiting on their Social Security benefits, or they are over 65 and will be losing group coverage because of an upcoming retirement or loss of group coverage. These people will need to go to their local Social Security office, call Social Security, or go online to set up Medicare. Social Security's phone number is 1-800-772-1213, and the website to set up Medicare is www.ssa.gov/benefits/Medicare. Make sure to do this 60 to 90 days before you intend to begin Medicare, so you don't have any delays in starting Medicare or get any late enrollment penalties. The delays can start if you do not enroll into Medicare the month of your 65th birthday or the month you intend to start Medicare. The penalties start accumulating for each month that you were eligible for Medicare but did not enroll into it. These penalties can be waived if you had other credible insurance coverage at the time. For example, if you delay enrolling into Medicare because of a group health plan at work. Next, after you have your Medicare card, you should meet over the phone or in person with an independent Medicare agent to discuss your options for Medicare Supplement or Medicare Advantage plans. A good independent agent will point you in the right direction. And if something seems a little off, just try someone else and see what they recommend. The agent will be able to enroll you in the best plan for you, and then you can move to the last step. The last step is to enroll in a Medicare Part D prescription drug plan. If you decide to go the Medicare Advantage route, you will most likely not need to do this step. But if you decide that a Medicare supplement is best for you, then you'll need to pick out a Medicare Part D prescription drug plan. You can do this by calling Medicare or going online to enroll in a plan. You can call Medicare at 1-800-633-4227 or go online to medicare.gov/plan compare. Make sure you have your prescription drug list, Medicare card, and your preferred pharmacies ready before you call or go online to pick out the best plan. The least expensive option is usually the best choice, but if you do want to pay a little more for a brand name insurance company, you can go ahead and do so. So it's as simple as enrolling into Medicare, picking out a Medicare Advantage or Medicare Supplement plan, and then enrolling into Medicare Part D if you decide to go the Medicare Supplement route. When you're on Medicare, you can change your Medicare Advantage plan or Medicare Part D plan every year during the annual election period that runs between October 14th and December 7th, and your new coverage will become effective January 1st of the next year. You can do this without answering any health questions. So if you are unhappy with your plan or anything changes in your life, you can make the change at the end of the year. Medicare supplements are a little more difficult to change because 6 months after you start Medicare Part B, you'll need to start answering health questions to qualify to change or start a new plan. This means it's easier to go from original Medicare with a Medicare supplement to a Medicare Advantage plan than it is to go from a Medicare Advantage plan back to original Medicare and a supplement. Thanks for making it to the end of the video. I know Medicare can seem daunting and confusing at times, so if you need any help with your Medicare enrollment, feel free to reach out to me or ask me any questions in the comments section below. My phone number is 920-960-4312, or you can email me at medicarescreenshare@gmail.com. That phone number and email will be in the video description below, along with any updated Medicare information for the current year. And as always, please like, comment, and subscribe so we can help more people.